Hi, my name is Andrea Mackey and I'm a Health Career Connections intern at Kaiser Permanente in Panorama City in complete care. I was born March 27th, 1995 in this very hospital, although where I was born is currently a dirt hole. I recently just graduated from Scripps College with a degree in neuroscience, and I aspire to become a physician. So how I found HCC was through my pre-med counselor. So what drew me to HCC was its mission statement, to empower students and graduates, particularly those from underrepresented or disadvantaged backgrounds, to choose and pursue healthcare careers. It was a perfect way where I can meld everything that I wanted to do together. So I want to become a doctor, but I want to become a doctor with intentionalities, to highlight the communities in health that aren't represented. I've been working for the past 4 years with the Southeast Asian and Pacific Islander communities to disrupt inequalities in education. Unfortunately, I wanted to do this in healthcare, but I didn't have the opportunities, or I didn't have the networks to begin. So what I loved about HCC, how valuable it was able to connect me to these different opportunities. And boy, did it give me all these opportunities.
My main focus was screening patients with a PHQ-9 to assess their levels of depression. Based off their score, I would offer resources that Kaiser has: online mood helpers, schedule them to wellness classes, or schedule them to meet with our social worker Hestia Lim. Working with mental health is especially challenging, especially when some people angrily deny the resources or screenings. I think the most important thing for me was learning how to talk to distressed patients and how I shouldn't reflect on the negative experiences. I also helped provide evidence for the need of a Spanish-speaking social worker, as 50% of our patients speak Spanish. We lose patients because of the language barrier, and to avoid fallout, we wanted to make sure we had a bilingual person on our team. But something that occupied my fellow intern and I, Kelly, was training the entire department in Excel, creating not only beginner, advanced, and handouts, but also providing tutorials for the entire department. We also got to shadow Mr. Linda Cursolo, and I never realized how much teamwork went into healthcare, internally and externally. This experience was powerful, and that made me stop and consider my personal goals. After talking to Mr. Linda, nurses, physicians, CEO, and my family, I've gotten advice and tips on how to proceed on balancing both. That's something I love to stress to future interns. Your greatest resource at HCC and in your placements are the people surrounded by your team. I tried to schedule as many informational interviews as I could to understand the different departments and how to lead. Your coworker stories and experiences can help shape your own. Everyone has a story they want to tell. You just need to ask the right questions. So thank you, HCC, for giving me the opportunity to tell my own story.